Thank you. Thank you, Madam President. I am indeed Evan Smith. Very kind introduction. And this is the time when I'm in El Paso when I talk about how much I love being in El Paso. And I do love being in El Paso. Fourth time I've been out here with the Tribune this calendar year. We do events here and elsewhere around town with elected officials and other policy folks. We have the old H&H versus L&J fight that so many of you have when we come to town. But I want to take a moment, instead of saying a word about El Paso, to say a word about President Natalicio. We've been friends for a long time. And I'm conscious of the passage of time and the fact that her time in the leadership role that she's been in for a long time will come to an end at some point. And I was reflecting on that this morning. The fact is that we live in an insane world right now, getting more insane by the day. And we need people of good character to be role models for all of us as leaders. And there is no better leader I know in academia or in Texas who has over time demonstrated the qualities of leadership that we so glaringly lack today in all aspects of our lives than President Natalicio. And I want to just acknowledge her and say thank you for continuing to be the person we all ought to be and the person we need more often than ever today. Give her a big hand, please. Yes. I love the fact that that was an organic standing Natalicio. Actually. Maybe we should just rename it that. It's now always, forever will be known as a standing Natalicio. Dr. Natalicio, everybody here at UTEP, thank you so much for, as always, being gracious hosts. Estrella, my great and old friend, my Texas Lyceum sister, thank you so much for your hard work in getting all this done. Frank, Bitzel, Beto, not that Beto, calm down. Everybody here on the UTEP staff, I want to thank you all. You guys, it's like the easiest joke to make in the world. Everybody at UTEP has always been so gracious to us for 9 years of doing events at the Texas Tribune. One of our earliest events, in fact, was out here, and everybody at UTEP has been great to us, and I want to thank everybody here for doing this. The events we do, more than 60 a year around the state, like this, elected officials on a stage, an audience in the room, we provide lunch, are all for the purpose that Dr. Natalicio said, to engage the people of this state in a conversation about the priorities that affect all of us. We can either choose to engage or we can choose not to engage. We can either have elections in which no one votes, which was every election I can remember until this one, or we can have an election in which people actually step up and understand that they are part of representative democracy. And we want more of that because regardless of the outcome of elections, it's better when more people participate and more people engage. And these events are the tee up for all of you to pay attention, engage on issues, and ultimately express yourselves at the appropriate point, however you choose to. These events are free to attend, they're not free to put on. Texas Tribune staff works very hard to organize these events around the state. I salute them, as you should. And our sponsors who make it possible for these events to happen are especially great because they pay the freight. They make it possible for us all to be here. Blue Cross Blue Shield of Texas presents our series of conversations around healthcare all year. I want to acknowledge them as our presenting sponsor. Also, Quest Diagnostics, the law office of my great friend Carlos Cardenas. Thank you so much for your generosity to us always when we come out to El Paso. City Health, the Meadows Mental Health Policy Institute, the Hackett Center, the Hospitals of Providence, Texas Tech University Health Sciences Center, El Paso, and El Paso Community College are the sponsors of today's event. Please acknowledge them, give them a hand for their support, and for making it possible for us to be here. Any of you who are members of the Texas Tribune, we appreciate you as well. You make it possible for us to do the great work that we've been able to do for Texas for now more than 9 years, and we will continue to do it for as long as we can with your support, and we thank you. Please silence your phones. For the benefit of people in the room and people on the live stream, we're live streaming this event as we always do. Please silence your phones. If you decide to tweet about this event, the hashtag is TT Events. Ordinarily, I'd tell you the Twitter handles of the people on stage, but there were like 100 people up here. It'll just take all of our time, so I'm not going to do that. Hashtag TT Events. We'll talk for about 45 or 50 minutes, the balance of time, questions from all of you, and we do indeed want to get as many of your questions into the conversation as possible. I'll advise you now, as I'll advise you later, when it comes time to ask a question, please ask a question, don't make a speech. We do want to hear from you, but let's give as many people an opportunity to get into the conversation as possible, okay? With that, it is my great honor and pleasure to introduce our distinguished guests, 5 of 6 members of the El Paso delegation at the Texas Capitol. The 6th member, Representative Pickett, who had intended to be here, was called away by a family emergency. We're sorry for that, but we're so pleased to have the 5 we have up here on stage. Let me briefly introduce them, and then we'll get started. On my immediate left is Cesar Blanco, Democrat of El Paso, elected to his House District 76 seat in 2014. In the 85th session, he is Vice Chair of the Defense and Veterans Affairs Committee, sits on the Land and Resource Management Committee of the House. He's a native of El Paso, and he is a graduate of the University of Texas at El Paso. Mary Gonzalez, Democrat of Clint, first chosen by the voters of House District 75 to represent them in 2012. In the 85th session, she's Vice Chair of the Agriculture and Livestock Committee, sits on the Appropriations Committee as well. She was raised in Clint. She has an undergraduate degree from the University of Texas at Austin, a master's degree from St. Edward's University in Austin, and is about to finish her PhD at UT Austin. I always check in with her at this moment and say, how's it coming? You're very close, right?
Very close, but so far.
But so far. At the moment, she's ABD. Anybody but, or anything but dissertation or whatever it is, right?
All but dissertation.
All but dissertation, but she'll get there very quickly.
Which is also called hell.
Officially, she's Democrat of hell, if you want to, if you're taking notes. Joe Moody, Democrat of El Paso, has served 4 terms representing House District 78. In the 85th session, he chairs the Criminal Jurisprudence Committee of the House, is Vice Chair of the General Investigating and Ethics Committee, and sits on the Juvenile Justice and Family Issues Committee. He, too, is a native of El Paso. He has an undergraduate degree from New Mexico State University and a law degree from Texas Tech University. Lena Ortega, Democrat of El Paso, is in her 1st term representing House District 77. She serves on the Economic and Small Business Development and International Trade and Intergovernmental Affairs Committee, pardon me. She is an El Paso native, a graduate of UT Austin and the University of Texas Law School. Finally, our lone senator on the panel, Senator Jose Rodriguez, Democrat of El Paso, elected to represent Senate District 29 in 2010. In the 85th session, he sits on the Agriculture, Water, and Rural Affairs, Health and Human Services, Nominations, Veterans Affairs and Military Installations, and Education Committees. He's a native of Alice, Texas, has an undergraduate degree from Pan American University and a law degree from George Washington University. Please give a big hand to our distinguished guests. Welcome them and thank them for being here. So Senator Rodriguez, as the lone senator, as I said, I'm going to start with you first. I want to ask a question that seems obvious to me but may not be obvious to everybody. It seems not to be in the Capitol since it's not happening. We're talking about public education as the defining issue of this session, and it's a good thing. It affects everybody. It's about time. It's overdue that we focus on public education as opposed to other things. But you know, healthcare is as big, if not slightly bigger, as a percentage of the all funds budget of Texas. Healthcare costs have been hockey sticking for years. Texas has the distinction, nothing to write home about, of being the state with the most people without health insurance, both the percentage of our population and raw numbers. And then subpopulations are also at the top, as we'll get into in a second. Why are we talking about education and not a peep about healthcare heading into this session? Senator.
Well, we're talking about education because, as you said, it's overdue. We haven't fixed the broken school finance system, and this is the year that we have to do it. But the implication that you're making, and I agree with you, is that we need to spend time on as much on health care. We still have, as a state, as you pointed out, high rates of uninsured, the highest rates in the country. And right here on the border in El Paso, upwards of 30% or so.
Right. Border counties tend to be double the uninsured rate of the rest of the state.
Absolutely. And in addition to that, we have some of the highest healthcare professional shortages in the country. So all of this ties into the general topic of access to healthcare, which is what I think we need to spend a lot of time on in this next session in the Capitol. I filed some bills related to that, and some of my colleagues have done the same thing on the House side, because we understand that without access to health care, I mean, what's the good of a kid going to school hungry or not having a proper medical treatment and being prepared to pay full attention in class? And so I think we have a lot of issues to address. We still are down at the bottom in a lot of these categories. We haven't expanded Medicaid. We haven't really, even though we've made some strides, and Representative Moody, Chairman Moody can talk about it, but And mental health, I believe, is something that we need to do a lot more in this state. I represent not just El Paso, but 4 West Texas, Trans-Pecos, rural counties, and access to health care there is monumental.
Well, in fact, Representative Gonzalez and I have talked recently at a Tribune event about the particular challenges of rural, and I want to come back to that as a vertical of this larger issue. But to stay on the general question of why, Representative Gonzalez, this is not a big issue. I know you've been advocating for education to be taken seriously by the legislature for some time. Education has been an intractable problem. It's been around for a while. You know what? So has healthcare. This is not new that we're #1 in the uninsured population. It's not new that we've not dealt with these issues. So how come we're not talking about it?
Can I be honest?
Yeah.
No,
don't be honest.
No one
Why?
tweet this. No, I mean it's politics, right? Like, and we're talking about education because there was a mandate by the voters that we're going to focus on education. And unfortunately, ever since President Obama got elected, I think that was the height of the polarization of healthcare as a political conversation, right? And so now it just seems like expanding Medicaid, common sense. It's bringing federal dollars down to Texas. It's increasing access to healthcare for Texans.
Right.
But it's so political that good policy gets wrapped up in partisan politics, and that's probably why we don't talk about it as much.
Representative Blanco, the fact is, in this election season, we had a number of states, well, maybe there's no state that's quite as red as Texas, although Texas seemed a little bit less red this time, but a lot of states that are in the ballpark of redness had Medicaid expansion on the ballot. The leaders of those states did not particularly want to expand Medicaid, but it ended up on the ballot, and overwhelmingly in those red states, Medicaid expansion passed. So even though the politics of the moment are what they are, we're not really having this conversation?
That's right, and it goes back to what Mary said. The big elephant in the room is Medicaid expansion, and that's up for our House, Senate, and the governor to decide and expand Medicaid. You know, you layer that with a Medicaid managed care system that is disastrous. We have substance use disorders that we're making headway, but we've got a lot more to do because we've got shortages. Same with mental health in terms of the field. But the big question is, we're seeing red states, as you said, Arizona, some of these other places that have expanded Medicaid because there's been a political will and political courage to take that next step and say, you know what, let's expand Medicaid, let's work with the ACA. But we've got an attorney general who's suing because of pre-existing conditions. We've got a governor who's decided not to expand Medicaid, and we need leadership from the top. And they just haven't had, I think, the political will to do so.
Representative Moody, since there are 5 Democrats on this stage, I'm going to play the role of the conservative. And I'm going to say, what part of elections have consequences don't you understand? I understand that you think Medicaid should be expanded, but if the people of this state were as agitated as you suggest and wanted Medicaid to be expanded, they've had an option every election cycle to vote the people in office out of office. And from what I can tell, they haven't done that. So maybe the voters have spoken as far as this goes.
Well, I think that I guess I would ask you to look a little bit deeper into the election results from last month. While there are still majorities in both chambers, while every statewide office is still held by a Republican, the devil's in the details. And look at the difference between a Greg Abbott result versus a Dan Patrick result. Look at the House results that we saw in our major metro areas and those families that are struggling to make ends meet, right? So let's look at where those margins have been shaved. By the way, in a map that is not meant to elect Democrats.
Right. So you think the mandate from this election, or the message from this election, was you guys got to get to work on some of this?
Well, and I think, so I think the reason we're talking about, and going back to your initial question, the reason we're talking about public education is because I think Speaker Bonin stood up when he had 109 votes and realized that if he's going to be Speaker this session into the future, he needs to right the ship on the Republican side of the aisle and get to work on meat and potato issues. So I'm not saying that we're not going to get to healthcare. I'm saying that he read the writing on the wall and said they're extending out a special session where there was a big debate between the House and the Senate on public school finance. Let's continue that kind of conversation and let's move it. Let's move it to the top of the heap, right, and show that we are serious about real issues. And I think healthcare comes in there as well. I think he just started with public education.
Before I go to Representative Ortega, Chairman Moody, let me ask you a question I've asked some of the others on this panel recently. Why do you believe people when they tell you that they're going to focus on education this time? It's a little bit like Lucy and Charlie Brown and the football. I feel like you all have run to kick the football at the beginning of every session only to have it pulled away. Why don't you think that leadership is going to pull it away this time the way they've pulled it away every other time? Why are you optimistic now?
Because elections have consequences.
Because you believe that, in fact, the message of this election is the voters.
I hope so. And look, you know, going into this election, if you're talking to anybody in Austin or in political circles around the state, which, you know, I had my ear to the ground in a lot of those circles, everyone said, well, 5 to 7 seats, 5 to 7 seats Democrats pick up, and we pick up 12. You know,
that's the best cycle you've had ever. That's the best cycle you've ever had.
And there were 4 others that were pretty much on the brink.
Right.
And so if you do not start having real results, you're heading into a presidential election where all those people are going to be on the front line of those races. If you are, I mean, if parties are meant to win elections, and I still think they are, then they're going to have to start focusing on real solutions for people.
Quickly, because I want to bring Rep. Ortega into this quickly.
So as chair of the HDCC that led the state effort to pick up more seats in the House, what do you think what was the message and what topics did we message in terms of our tactics?
Right.
It wasn't SB4, it wasn't things like women's health, things like that. It was property taxes. And there's a direct correlation between the state's lack of investment in public education and raising taxes in these local communities. So I think the message is clear, and I think Republicans are talking amongst themselves and saying, we got to do something about this.
Right.
Really quickly.
Yeah.
You asked me this question in the last panel, and I hate you for asking this question because it goes counter to democracy.
Narrator, she doesn't actually hate me. This is like Arrested Development. Go ahead.
Because, okay, what's the alternative, Evan? The alternative is we're angry, or we're like, oh, we're not going to fix school finance. I'm going in the next session saying, yeah, we've tried. We didn't get it done. I'm not going to be pessimistic about it. I'm going to be optimistic
Blue
that we
skies
can.
ahead.
Well, what's the alternative?
Right. Well, Rep. Ortega, let me bring the room down a little bit here after this unusual burst of optimism and note that the problem is not just that Texas continues to lead the way broadly in the uninsured population, but we had a report last week or the week before that after a decade of the population of uninsured children declining in this country, those numbers have started to spike back up. And what do you know? Texas leads the way. 835,000 uninsured children in Texas in the last reporting period, including a 1-year gain in uninsured children of 83,000, which it occurs to me is about as many kids as we're adding to the public school system every year in Texas. If we have to fund growth on public education every year, why don't we fund the opposite of growth on this issue? I mean, it seems to me that these are 2 issues to choose from, and either one could be the focus of our attention.
I agree with you. I think that they should have equal focus, and especially because of the numbers that you've given us and what's going on in our community. As you said, the border communities actually have more uninsured than the other parts of Texas, and it's been increasing since 2004. And when you think about the fact that having health insurance helps children go to the doctor, it helps them not miss school, it helps them in many different ways, and that's hurting the state of Texas. And I think the state of Texas, and somebody asked me when I came in, what is it that we can do in this community? Well, number one is we've got to have our voices heard. Whether we're Democrats or Republicans, healthcare should be as high up as public education. I'm not telling you education is any less important, but those 2 are the top issues that we ought to be focusing on this legislation. And obviously the thing that we can do as a delegation is bring forth legislation that we can push to help our community and to help statewide, and I am sponsoring medical health legislation.
And the fact is Democrats have 67 this time as opposed to 55. Last time it's a lot harder for Democrats to accomplish anything or prevent anything with 55 than it is with 67. You have 67 if you hold it together, and let's acknowledge that you got to hold it together, right? But if you held it together, you've got 9 or 10 wayward Republicans to join with you. You have the ability to do something. Representative Blanco, you brought up property taxes. I thought it was interesting that you made the connection, not surprising, between public education and property taxes as a driver of activity in this session. Of course, what else causes property taxes to go up? uncompensated care in hospitals, say, somebody goes to an emergency room with a primary care need, not an emergency, but they get treated because they're not going to be turned away. The cost of that care is passed along to all of us in the form of property taxes. It could be said, if you're so concerned about property taxes going up, one of the first things you might do is fix health care, right?
Absolutely. Before I answer the question, I want to compliment Chairman Moody's UTEP colors, his socks and his tie. Very, very fashionable, sir.
He's such a suck-up, isn't he?
As an NMSU graduate, I have to. This is my apology.
He's always such a good boy, isn't he? He's a good boy. Okay.
Well done, Chairman. Well done.
Yeah. So why are we not talking about healthcare through the lens of property tax?
I'll give you an example. UMC, we have a hospital district here in El Paso that taxes our community, $85 million a year. However, they spend $165 million in charity care. That's uncompensated care. So there's a lot that the state can do, both not only in education but in healthcare, such as expanding Medicaid, such as providing more funds for access to care, such as GME and things of that sort. But the state has refused to do it.
The Representative Gonzalez, the thing is that the property tax concerns that are discussed in the context of education are not Democrat concerns or Republican concerns, right? Nobody wants to pay more property taxes. Property taxes have gone up for a variety of reasons at a local level, but this is a big chunk of it, is it not?
Definitely.
And it's something that if you were to address the uninsured problem, by necessity there would be, I mean, the thing about property taxes and education, as you all have discovered in the course of this, is it's not so easy to fix. This is pretty much an A to B through line. If you lower the number of people without insurance, then you lower the uncompensated care, and therefore the property tax problem is a little bit easier to solve.
Well, and here's the thing: healthcare, while it can seem, and this is the problem in public policy, is we silo off issues. Here's healthcare, here's education, here's agriculture, and the truth of the matter is, it's all interconnected, right? From access to healthy foods, right? With Paso del Norte Health Foundation is doing amazing work, or which then means if kids don't get healthy foods, and they don't have access to doctors, and they're not going to schools, and it's impacting attendance, and it's impacting school finance, and it's all a domino effect. Ultimately, and we're paying that paycheck in property taxes. And so what we really need to do is think more complexly and intersectionally about these issues. And so, yes, could we go back and fix uninsured? Right. But again, this is really up to voters. You want us to fix it, we want to fix it, but we really need the leadership, and we need to send that message to the governor.
And Representative Ortega brought up the fact that there's a connect between, I want to ask you, Representative Ortega, about this. You brought up the connect between public education and healthcare. You know, healthy kids go to school, they're able to learn and do well and hopefully advance. The fact is, you want a healthy workforce. Same thing. If you're in the business community, you want people who show up at your workplace every day to be healthy, to be productive. I mean, I don't want to spend too much time on this because it's maybe a conversation for another event. But paid sick leave looks to be setting up as a big fight at the Capitol in the local control bucket, right? Austin and San Antonio have both approved initiatives to require paid sick leave of private employers, and the courts have already come back and said, no, you can't do that. But we're going to be fighting about it during the session, and the reality is that is as much an economic development issue, is it not, as a healthcare issue? The question of Representative Ortega. Oh, okay. Healthy workers showing up in a workplace, that's as much an economic development issue.
That's true,
right.
And it's something that we should actually be paying for it. And you're saying, and it's correct. There's going to be a fight on that. Right. But going back to education, we also need to fund higher ed more so they can have programs available to actually increase the healthcare providers that we desperately need in this community. So there's different angles to go about it.
Yeah. Let me, Senator Rodriguez, on that. So you brought up the GME question and the idea of not having enough health professionals. It's not just access to coverage, it's access to care. Yes. Right? We don't have enough doctors, we don't have enough providers. The federal government has a designation at the U.S. Department of Health and Human Services, Health Professional Shortage Area. Texas has 254 counties. More than half the counties in Texas are designated as health professional shortage areas by the federal government. There are something like 35 counties that have no doctors at all. There are 80 counties that have no psychiatrist, no surgeon, no gynecologist. So we don't have enough doctors. The higher ed question is an interesting one, is it not? Because we're trying to get more doctors trained in Texas and then staying in Texas.
Absolutely.
Right.
I think that it does us no good to invest so much money in training for the ones that are in our professional schools, medical school, dental school, and so forth, if we're not going to provide incentives for them to
remain
stay
here
and to remain in the medically underserved areas,
right,
and high, professional shortage areas.
Right.
It seems to me that in this state we're always shooting ourselves in the foot. To me, it always goes back to the question that Steve Murdoch, the former state demographer, has posed for years to the Texas legislature. Fastest growing, youngest population in the country,
yeah,
the Latino students,
yeah,
right? Investment in our schools to ensure that we don't have the high dropout rates, to ensure that we have more opportunities to go to college
yeah,
and to stay in college. Somehow that falls on deaf ears.
Yeah.
We're talking about, I think President Natalicio mentioned the formulas funding for the universities.
Yeah.
That's a big concern, because there are those in the legislature, those in control of the legislature, who don't want to see more investment,
right,
both in higher education and public education. In fact, I hear all the time from the lieutenant governor, we already invest too much in education. That's not the problem. The problem is, inefficiencies, overloaded bureaucracies in the administration levels and all that, which is nonsense. All the experts say otherwise. Right. And they've said that in the school finance litigation. So, but I want to say this too, Evan. The way you started out is, why are we focused more on public education and not on healthcare? I, for one, and I think I can speak for my colleagues here, have focused on healthcare from the time I got into the Senate.
Right. Well, I didn't necessarily mean the individuals on stage as much as the institution of the legislature, because there are a bunch of big issues you have to deal with. Bags of garbage on fire every session show up on your doorstep,
the
right?
institution of the legislature goes back to what my colleagues were saying, and that is, it's controlled by the leadership on down to representatives and senators who don't view government the same way we do.
Rep. Moody, this is the issue that I think, I'm always curious about this. A lot of talk, again, in the realm of education, that the state has gotten out of the business of funding public education to the degree that it once did, right? And that's why property taxpayers at home are having to bear the cost. The same can be said for higher ed, right? Whether it relates to GMEs or the investment in universities like this one, which are trying to train the next generation of health professionals. The state's gotten out of the business of funding higher ed to a great degree, and the payment of tuition dollars by students and parents have gone up as a consequence, right?
Well, and then also just look at incentives like the senator talked about, physician loan repayment program.
Right. Something
we created a decade ago and then yanked all that money back. And those were funds. And in fact, there's an article back in 2009 and 2010 talking about a doctor here in El Paso on the Tribune about this is the reason this doctor is here, because we're in a medically underserved area, and this allowed for this doctor to be able to pay back loans.
Everybody wins in a situation like that.
So programs like that, they're smaller investments, but they're actually very targeted and productive investments. So increasing GME, everybody talks about that, but we probably need easily $60 million more than that this next go around. So those are the types of things that we can, aside from, and it seems like every answer to any question you're going to ask is expand Medicaid first, and then everything else we can. So if that's the big thing that we need to figure out how to tackle, the smaller things around the edges are some of these ways to expand the workforce, and also, and I know it's always a dangerous conversation, but scope of practice is always a dangerous conversation in the legislature. But figuring out how to get people into their proper educational. Where their education leads them to let them practice to the maximum of that, because those are all those physician extenders and all those people that can be part of a continuum of care are necessary, and we need to get to a comfort level of expanding where we're comfortable with those people doing their work, because we can't just say we're not going to sit at the table to discuss that anymore. Yeah. It's just unacceptable.
Representative Gonzalez, it really is, I said access to coverage, there's also access to care. The third leg of that stool really is access to venues in which to receive care. You represent a district that is pretty rural, and you are a child of rural Texas yourself, proudly.
Vice Chair,
right?
Anyone from Clint?
Vice Chair of the Ag and Livestock Committee. We have read repeatedly over the last couple of years about the closure of rural hospitals, rural health providers, and people say, well, let's just go to telemedicine for those communities, except that we don't have adequate rural broadband to allow for telemedicine to be a solution to the problem. Is this something you all are going to look at seriously in this next session, what to do about rural health care? I know that the populations of rural communities are declining, But there are still millions of people in rural Texas, right?
I mean, yeah, I think that we have to look at the future of rural Texas in general. What does rural Texas look like 20 years from now, right? It's not just about healthcare. It's about economic development, infrastructure, schools.
Right.
And so you're right. One of the biggest tragedies that isn't talked about is the lack, and there's a closure of rural hospitals. For all we talked about maternal mortality last session, the fact that women who are having babies in rural Texas cannot get to a hospital, therefore increasing their likelihood of maternal mortality, women dying having babies just because of where they live, is really something that we can't say we care about, maternal mortality like we did all last session, and then do actions and policies that counter the actual needs of addressing that issue.
Right. But Representative Blanco, this is the conundrum. If the populations of these communities are declining, and if the business of being in the business of being a rural hospital is declining as well, these providers are making an economic decision in a lot of cases. I mean, I understand that there's a fiduciary aspect to the provision of health care in a community like the rural community we're talking about, but there's also an economic imperative here. Can you really say to these providers, even though this is a losing proposition for you economically, you got to stay open because. Can you prosecute that case?
Sure. I mean, look, it's like what came first, the chicken or the egg, right? Like we don't have providers in these rural communities. To Joe's point, we've cut back on programs that aren't very costly that incentivize family practitioners or providers to practice in rural communities with loan repayment programs and things like that, which has been cut. Right. By 40%. That specific program was cut by 40%. To plus it up this session, it would cost about $4 million. For the physician loan repayment program for communities like El Paso that are underserved, $8 million. That's budget dust compared to the $800 million we're spending in border security.
Right, and the full budget last year was about $260
billion.
$216 billion for 2 years. So you're talking about how much money? You're talking about in the millions with an M.
It's
right?
with an M, and when you have places like pharmacy programs at UTEP that we're asking $4.6 million for Texas Tech, dental school that we're asking for $50 million in a biennium. It's such a small amount, but with such a huge ripple effect. Where are those? You asked me about the rural communities. Where are the folks from Hudspeth County, from Van Horn? Where are they going to go get their care? Here in El Paso, because we're going to be the closest places to them.
In the absence of providers in their own communities,
right.
They're going
to or they don't get care is what happens. Right. I mean, because they can't come to El Paso, so that's why telemedicine is so important.
And yet the broadband, Representative Ortega, that allows for telemedicine, as we said, to be activated is not necessarily what it needs to be. Senator.
Well, I was going to say, look, we can spend a lot of time on why this is happening in rural areas, the urban areas. The bottom line is we need to look at the whole healthcare system as a whole.
Yep.
And I think there's been more of a national conversation about universal healthcare. Ultimately, from the economic standpoint, as you pointed out, it's hard for someone to be a provider out there in rural areas.
Right.
So government is going to have to step in and find ways of providing healthcare services to everyone.
But again,
it shouldn't matter whether you're in a zip code or in an urban center or in a rural area as to whether you're going to get access to healthcare or not.
But you're pushing against the politics, Senator. You're pushing against the politics.
Well, I am, and I think that's what we need to do. And I think this last election is finally showing those trends. This is
Representative Moody's point. Right?
Yes, with the realization on the other side that maybe they need to start changing their tune because they could be next, apart from those 12 that flipped this last time. You see what I'm saying? 2 in the Senate. The Lieutenant Governor won by, as you know,
five points.
I thought it was 3 points.
No, he won by 5, but still he won by 19 the last time. So your
so
point is made.
So I think the realization is going to start seeping in, and I've heard indications of that already, seen some of it from our leadership and from some of these very conservative, anti-government, anti-spending representatives and senators that they're going to have to start looking at it differently. Otherwise, they're going to join the heap.
Right. Representative Gonzalez, and I want to go to Mr. Moody about the budget in the main.
Well, this is why government exists, Evan, to create healthy and safe communities. And so when we have a state as big as Texas, 30 million people, 254 districts, it's diverse, right? And so what leaders need to do is say, what does each region need, urban, rural, communities of color, border, and then create public policy that addresses the diversity of our state. If not, we can just, become a state like Rhode Island that's a very, one little community, right? But we're not. And so if we're truly going to address these issues, then we need to look at all of the diversity. And here's the thing, what did you have for breakfast?
I don't eat.
You don't eat. Well, I had eggs.
It's a trick question, isn't it?
I had eggs for breakfast. And if you still want to have your eggs for breakfast, or if you want to wear your fancy suits, then we need food and fiber to be created in rural communities, right? Yeah. And we have to recognize the interconnectedness between rural and urban. And if we don't recognize that, and if we recognize that, then we want to create diverse policy solutions.
Rise together, fall together.
Yes.
Chairman Moody, I want to quickly sort of step out of the conversation that is expressly about health care over to one about the budget generally. Representative Blanca was talking about, well, it's this much or it's that much, and you consider the entire budget. This is the first post-Harvey budget we're going to pass. You all kicked, as I said to Representative Gonzalez the other day, you've kicked so many cans down the road from the last budget, you have enough for a 12-pack in this next session. You think about all the things that you chose not to do, figuring you'd come in and pass a supplemental budget when you came back. So you're already in the hole to the tune of a number of billions of dollars, and you've got the rainy day fund, but of course it's limited and its use is by tradition limited as well. Are you going to be able to afford to pay for anything in the next session that you don't already have committed, given the fact that you've got this big Harvey cloud looming overhead?
Oh, I mean, the ask right now is to make cuts. I mean, that's what they ask of.
They've come in and they've said everybody should prepare to see their budgets come down.
Yeah, but I mean, some of the things we're talking about, we're making a cut in public health, in terms of getting adults immunized that can't afford immunization. So we're going to cut that program. Our HIV program, we're going to cut that program. So I mean, things that affect healthcare and public health in a very large way are on the table for cuts this session. So I think you raise a very good point. I think we're going to have some very difficult decisions. Harvey looms over the top of it. Some of that stuff is, some of that stuff is not going to be budget based. It's going to be policy based, but much of it will be budget based. And there's been some willingness to dip into the rainy day fund, economic stabilization fund. But like I know when we were at TripVest, Joan Huffman on our panel said she'd be willing to use the rainy day fund to expand mental health services for our public schools. And so we need to figure out where those avenues exist if we're going to do those things in the short term, because you can't do those for continuing costs for the most part.
I mean, Representative Blanca, you know that the rainy day fund has been kind of a third rail budgetarily in this capital.
Right.
It's, you have this money in a savings account, can't touch it. Well, it actually rained.
Right.
Right?
A lot.
It rained.
A whole lot.
Right.
Flooded.
Yeah, look, if we don't use the rainy day fund, it's going to affect our credit rating.
It's going to affect, say that again.
If we don't use the rainy day fund, it's going to negatively affect our credit rating.
Credit agencies have suggested as such.
That's correct.
Right.
Not only that, there was a report that the comptroller put out about how much tax abatements and tax loopholes and foregone taxes that the state has provided. The party's over. I think it's time that we start to utilize these funds and close some of these unnecessary tax loopholes to make sure that we're paying for the things that are important, making investments into healthcare and education.
Close loopholes. You mean raise taxes on business?
The party's over.
No.
Is that not the practical effect of talking about close? If you close a loophole,
I'm not saying,
taxes are going to go up.
we're not saying eliminate them completely, but we could hit the pause button for a biennium and take care of things like what happened in Harvey, and take care of things like our healthcare system, and make investments in public education as well as higher education. And then, of course, the budget is a document that tells everyone what our priorities are, and we're spending, again, border security, hundreds of millions of dollars when all the data demonstrates that we're a safe community. El Paso, you're one of the safest communities in the country. So all of this political rhetoric, it's all about priorities, and quite frankly, our state has misplaced priorities.
I want to come back to healthcare, I promise, but I want to just ask quickly, is there agreement on the panel about that if you had the opportunity to cut border security funding and redirect it into public ed or to healthcare, that you would do it? Show of hands, who would cut the border security funding for that purpose? Is that an El Paso layup?
That's an El Paso layup.
A Don Haskins inspired layup? Is that right?
But look, you just put your finger on another pot of money, right?
Right.
Almost $1 billion for border security that could be used for education, for healthcare. The exemptions, tax exemptions, the loopholes that Representative Blanco is talking about. I'll just give one example, oil and gas industry. I don't see it as raising taxes on the industry
right, but
if
you
we close down the loophole, Evan, because that is an exemption that was given to encourage exploration and development of the oil and gas industry way back.
And your view is they're doing okay now?
My view is they're doing
Please
okay.
And thank you.
That particular public policy reason behind the loophole was already exhausted. It's lived to this not necessary anymore. And I could say the same thing about some other industries. Likewise, the comptroller said with respect to the rainy day fund, not only, well, all of us feel here we ought to tap more into that for education. I think it's been raining on education, just like Harvey brought some rain over in Houston. But the comptroller said, why don't you consider investing, creating a trust fund or some kind of investment fund to draw down interest that can be a revolving source of revenue for the state? There's all kinds of ways of generating revenue, but which the leadership that we have now,
at least at the moment, is not bought into.
Is not buying
Let
into
me
that.
come back to Representative Moody and ask about mental health. Mental health has come up once or twice in this conversation. You were vice chair of a select committee appointed session before last to look at this issue. There has been some improvement, has there not, Chairman Moody, in mental health funding, behavioral health funding in Texas over the last couple of sessions?
Yeah, there was significant movement in the last session.
Right.
I just did whatever Sharon Butterworth told me to do, and so that took care
You are not the only one.
That took care of my policy background. So
should we regard the problem as sufficiently addressed? Now move on to other things.
No.
And if not, what do you do?
And I think that's the part we need to be careful about. And Speaker Strauss, in his wisdom and his team's wisdom, was building this to a point that it'll always be an issue. So it was always a two-session, two-interim deal. There was the mental health, the Select Committee on Mental Health, which went into the session in 2017, expanded resources, we expanded bed capacity, we looked at our state hospital system, we have tried to take a population that we had been handling in the criminal justice system and move them into the healthcare system where they belong and start to change that dynamic. And then the second interim was the substance use disorder select committee and the opioid, well, they call it the opioid committee.
And you're vice chair of that select committee.
Correct.
At the moment,
and so this was a two-step process that was meant to elevate these issues to a point that didn't matter who the next speaker was, didn't matter who the next leader in wherever was. These issues are now prominent in Texas because we are going to make mental health care and substance use care in this state top-notch. We are going to make this a place where people are going to come for that treatment, much like people come from around the world for cancer care in Texas. We want to make Texas a center of excellence.
Right, but the resources, Chairman Moody, the resources necessary to enable that are significant, and as of right now, they're not available.
But they were. It was never meant to be one biennium. I mean, that was.
So this is it's a marathon and not a sprint.
So MD Anderson wasn't built in 2 years.
In a day,
this is a 50-year program to make Texas a center of excellence for cancer care. So we have to look at this in a 50-year projected timeline. And so we're in year 4, or year 3. And so this is something that leadership is going to continue to have to push on, and I think we have the opportunity to do it. And local communities like ours here in El Paso are already making use of those funds. We now have a crisis intervention team that's going to be plugged in with our police department. Our police department prior to that had some significant issues in handling individuals that it encountered with mental health issues. There's federal lawsuits that deal with that.
So you think there's been a positive byproduct of those efforts,
But we have here in El Paso, you're going to have this issue, and that saves money. That saves money at the local level. It saves money in our emergency rooms. When we have someone planted in our emergency rooms that's going to have extended observation so that we can track them into the proper care they need, that's huge. And when the state invests, that investment for El Paso for the PD initiative was $2.8 million.
Again, back to the question of million with an M.
Exactly.
Right, as opposed
and so
to million.
These are things, and while you can't, again, you don't build the mental health care infrastructure overnight. You build it and you build the structure, and then you feed it over time to fill in those gaps. And I think we've gone a long way in a very short period of time, but the job is far from done.
Representative Ortega, you're a former prosecutor, right? you're an attorney.
I used to be an assistant federal public defender.
Right.
But I'm civil.
Civil, but you have seen the legal end of this. You understand what Representative Moody is talking about, that this is as much a criminal justice issue as it is a healthcare issue.
Oh, yeah.
Right? On the school safety question that came out of the Santa Fe shootings and other tragedies like that, those are as much mental health conversations as education conversations, right?
That's correct.
So this is, to Representative Gonzalez's point, an intersectional issue, right? Mental health cuts across a lot of these verticals. And it seems like you could take care of a lot of different needs in the state. If you focused on that one, it would touch education, criminal justice, and so on.
And just healthcare when you
Right.
talk about it. And I think that the next session is going to be eye-opening in the sense that because of what occurred in November, the fact that we have now 12 new Democrats in the House, the fact that so many races were closed, I wonder if state leadership is now going to be looking at things a little differently. So I suspect what happens at the next session is going to kind of direct what's going to occur in the future years to come.
Representative Moody,
This is something I try to raise when we talk about school safety and,
Yeah.
and mental health, and we just need to be very careful about that conversation. There's been a large leap that we've made in terms of ending the stigma around mental illness. So we need to caveat that conversation always with, you are more likely to be a victim of violence if you are suffering from mental illness or mental health issues than you are to be the perpetrator of violent crime. And so while mental health while there are certainly things that we need to do in our public schools
Yep.
to address mental health, in that conversation we need to be very, very careful in not taking a step backwards on ending the stigma around mental illness.
and indeed the entire school safety conversation has been essentially reduced to a conversation about that.
Well, and that's unfortunate, and that's part of the process, the progress that we need to defend and maintain.
Let me run to a couple of other issues here before we go to questions. There's so many more things I want to talk about than the time will allow. Representative Gonzalez, women's health has been a political football, oddly, maybe not that oddly, over the last couple of sessions. And there have been a lot of discussions about exactly where the state should play a role, where funds that are allocated should go. This is not a conversation that at the moment is a top of the agenda conversation, but half the population of the state is female. Women's health is always something we should be talking about. Where will we land with that issue in the next session? What do you think?
I think you're right, and sadly, women's health has become a politicized issue, right? The cutting of the Texas Women's Health Program, the lack of access to funds, the closing of clinics. I mean, this has really become, and the consequence is women's health has been put really in danger, and that's why it's not an accident that maternal mortality is a problem in Texas. It happened because bad policies were passed in the legislature, and thus the consequence was women and children's lives. And so, what will we see next session? I think it's a little scary, right? I think with the Supreme Court differences now, the makeup of the Supreme Court, it is a little bit scary to bring up issues of women's health because it could always go backwards instead of forwards. But B, I do trust that at least in the House, I have seen recent actions that are more balanced, that are less politically partisan, and so hopefully, we can do something. But if I'm usually very optimistic, but when it comes to women's health, I'm a little bit more nervous and have some anxiety around whether we're truly going to address the problems or we're just going to say we're addressing the problems and not truly addressing them.
Rep. Ortega, this is the thing about maternal mortality. I mean, what Representative Gonzalez says is true. Maternal mortality, there's a long tail of this larger conversation that has led us here. But there was a lot of focus last time about the extraordinary status of Texas compared to the rest of the world, not just the rest of the country on maternal mortality. Now, the data was reset so that we're not like world's worst by 1,000,000 times.
We're still pretty bad.
We're still like world's worst by 2 times, right? But it's still, we've been downgraded to merely spectacularly awful from wherever we were supposed to have been before. But this, like public education, was kicked down the road. Well, we're going to study it. We're not going to take action. We're going to study it. So what's going to happen on the maternal mortality issue specifically in this next session?
Well, actually, there was a report that just came out, and I think one of the problems that we were seeing with the issues with mothers dying or dying during pregnancy or afterwards is, and because of the fact that it's been studied more, they are recommending safety bundles. And we've seen that in California, that has been incredibly effective. And we've got a lot of hospitals, even our own hospital, UMC, who who is doing this voluntarily. The state is not going to actually impose that on hospitals, but there are many hospitals across the state that are participating, and I think that has been a real issue for the state, obviously, and I think that we're going to see improvement, which is very much needed.
Rep. Gonzalez.
I just want to say thank you to the healthcare community. I mean, you're right. We kicked it down the curb. We knew last session things that would actually change maternal mortality for women. I'll give an example. I have a bill that I couldn't get passed last session. We're trying to pass it again this session, but it was simple. One of the barriers to access for women's health care is that women couldn't bring their children with them when they got Medicaid transportation. And so if you have a 9-month-old and you need to go to the doctor again, you couldn't bring your 9-month-old. And so it's a simple public policy change that says, hey, if you're going to go to the doctor, you can bring your child. And
what's the objection to that?
The cost, and the cost was minimal. I mean, anything that had a fiscal note last session was like, well, we can't pass that. But here's, and this goes again about, are we going to walk the walk or talk the talk? Because we can say we care about maternal mortality, but we have policies that can really change the dynamics.
I'll give you another example.
Yes.
Another example.
Yes.
The task force on mortality has recommended for quite some time that we extend the current statute of affording women on Medicaid that get Medicaid for 60 days after delivery, to extend that to a year. It's a bill that I have filed, other people have filed.
And this is a recommendation of the maternal
And it's a
mortality
recommendation of the task force.
Right.
But yet, I didn't even get a hearing on the bill.
Right.
And so...
You're going to bring it back again this time?
I've already filed it.
Great. Okay.
And going to that, with regard to insurance, where there is insurance for these women, they're not even aware of the fact that once the 60-day postpartum period is over, that they actually have insurance where they can go and seek care if they need it. So I'm filing a bill that I'm working on right now to make sure that they're notified while they're pregnant in order for them to access the health care that they need.
Right. Quickly, before we go to questions, Representative Blanco, Senator Rodriguez, anything that will happen on veterans' health in this? I mean, we think about the veterans' health conversation is more of a federal conversation rather than a state conversation. You both serve on committees concerned with Veterans Affairs. Obviously, anybody in El Paso is thinking about the community of veterans. Anything we can do here or you can expect to do in the next session?
Sure, I think one of the most important things is mental health.
Going
back to mental health, and again, expanding Medicaid solves a lot of these issues, right? But you know, mental health for veterans, it's a big issue.
Yeah.
If we had more mental health care providers, and you know, if UTEP had for example, an advanced practice nurse practitioner program for psychiatry or something like that, we could have more practitioners in our communities. And right now, the average wait time for a patient who needs mental health services is 118 days. And then it goes back to our criminal justice reform. I mean, where a lot of psychiatric beds are being held by criminal-related folks that have mental health problems. There's a lot that we need to do, but in terms of veterans' mental health, we can do. And last session, I authored a bill that is going to expand, and it passed with myself and Senator Campbell, that expands access to more providers specifically for veterans in Texas.
Senator, quickly, what do you say about that?
Well, I mean, it's the same thing. Senator Campbell is the chair of our Veteran Affairs Committee that I serve on, and there's no question that we need many more programs, many more providers. The question of suicide amongst veterans is an incredible problem for us, post-traumatic stress disorder, in addition to other mental health conditions. So we are looking as a committee to continue making progress in programs that provide those kind of services for veterans. I mean, for us in El Paso, it's a no-brainer. We got to work on that.
All right, so we're going to ask you to line up here. We'll have questions in the microphones. If you have questions, come on up. But the last question is, of course, the one everyone came to hear about. I've saved it for last. Chairman Moody, will you finally make marijuana for medicinal purposes legal in the next session? That's really all anybody cares about. So,
well, Texas took a large step in the last few years. Greg Abbott signed a bill that, while it's a small medical cannabis bill, it says Texas now officially recognizes cannabis as medicine. and for children with intractable epilepsy. Are there other uses for that? Why does it's called the Compassionate Use Act, the Compassionate Use Registry. Why does our compassion stop there? Why doesn't our compassion not extend to other individuals that need that care, that want to choose that care? So do I think that passes this session? I don't know. I'm working on also decriminalization legislation that I do think has a pretty...
You'll have a conversation. But I mean, again, we said earlier
Sure.
that there were red states on the ballot this last November 6th that approved Medicaid expansion, despite what you thought the politics would be. Also, a number of red states passed loosening of marijuana laws.
Well, the Republican Party of Texas has a plank in their platform that says we should decriminalize small amounts of marijuana.
Right.
So,
okay. We'll go and we'll take as many questions. I'm apologizing in advance if we can't get to them again. Out of deference to your fellow questioners, please ask questions, don't make speeches. Sir.
Shafiq Dharamsi, I'm the Dean of the College of Health Sciences here at UTEP. And we have many of our faculty members, health educators, and many of our students who are in between exams. What advice can you give us as educators on how we can better prepare the next generation of health professionals to address many of the health disparities that you've referred to? And if you could also speak to our students, what advice can you give them as they prepare for their careers? Thank you.
Jump ball.
I can jump in on that. For you healthcare professionals, run for office. Because we don't have enough healthcare professionals that are making important decisions such as this.
Yep.
There's
just a bunch of lawyers.
Yeah, it's a bunch of lawyers.
I'm not a lawyer. I think that's a really great question. Here's what I will say we can see from last election cycle is teachers are educators were very engaged, very organized. They took tons of workshops on how the public policy process works. And it started, I went to talk to a bunch of master's students who were in the College of Education all over the country. So what I would say is you start them young, you start having conversations about how does public policy impact your job and the people you're trying to serve, and really connect it. I think the reason people aren't connected with public policy is they say, oh, it doesn't impact me. And I think if people really knew how much it impacted them, they'd be much more passionate about their engagement.
I would say, Evan, that, and we've talked about it in terms of the access to healthcare professional shortages, the need in the rural areas, to provide more access to healthcare, that we focus not only on trying to get the right programs and the right incentives, as we mentioned, to attract more people into staying in those professions. But we also need to, something that we hardly spent any time on, but Chairman Moody brought up scope of practice. One of the things that I do here at UTEP every year, and I just got the invitation a while ago from Mr. Morales, is to speak to the advanced nurses, the master's and doctoral program here. Yep. And one of the issues that I always discuss with them is the importance of having advanced nurse practitioners be given full practice authority in order to provide. Thank you.
And this has been a fight at the legislature for a number of sessions.
I file a bill every session, and I've got another one this session, trying to chip away at that scope of practice requirement that you got to be subject to directions under a doctor. So we can do things like that will open up more access for people.
And then just quickly, I think UTEP is doing this, but continue your pipeline to younger people, to high school students, to get them to go into the healthcare fields.
Yes, starts before they even get here. Ma'am.
Hi, I'm Dr. Kathleen Cox. I'm the director of the Adult Gerontology Acute Care Nurse Practitioner Program, and so this is a beautiful segue. That's what I want to know from you all. What are you doing? We have a whole pool of advanced practice nurses that are more than willing and able to provide care, and we don't have full practice authority. So, and we're graduating them as fast as we can, and we don't have enough faculty, but still, we're graduating them.
Chairman Moody, who's blocking this legislation? I did warn you this morning in a text that I could hold up that I was going to ask you all the hard questions. So who is blocking this?
It's mysterious.
No, it's not.
No, it's actually not.
No, I mean, you're gonna have
it's very open.
These are the physicians that it's essentially protecting your practice. But for people here in El Paso, right, where can you go to get a job where you have full practice authority? Right next door, right against my district. I'm up against New Mexico. Someone can literally move 5 minutes and use their degree to its full potential and open their own shop and be living a much better life there. Why are we doing
So we're
that?
working against
We're working
ourselves,
against ourselves.
in that respect. Sir.
Well, I'm Alvaro Gurovic, the director of physical therapy, and the same question, direct access for physical therapy, and the opioid epidemic that we have right now. The CDC has guidelines that non-drug therapy, like physical therapy, can tackle the opioid epidemic right now, and we don't have direct access here in Texas.
We have, in my view, a very antiquated scope of practice rule here in this state. It applies not just to physical therapists, to advanced nurse practitioners, to podiatrists, to optometrists. I could go down the list because I've talked to all of them.
Well, let me ask Chairman
bills.
Moody.
But let me follow up on this.
Yeah.
It's not just that they go to New Mexico, because New Mexico gives them full practice authority. We've invested in all of these advanced nurse practitioners here at UTEP.
And then they leave and go somewhere else.
And then they leave.
We're training everybody else's.
We're training
professionals.
somebody else's healthcare.
To Chairman Moody, you're as vice chair of the Select Committee on Opioids and Substance Abuse. This is an interesting point. Are you talking about scope of practice purely in the context of opioids as well?
It certainly came up during conversation. Now, my brother is actually a physical therapist trained here in El Paso, and so we have had multiple conversations over years about scope of practice and what he's able to do within his educational attainment. And he certainly was capped in what he could do and what he could do for his patients within that. And so I think in the opioid conversation, we need to be very careful, and government has a tendency to correct itself. So opioids play a significant role in pain management, and so we should make sure that people still have access to appropriate pain management. But where we have alternatives like physical therapy, and I'm a big believer in physical therapy, then we need to make sure that we're taking those options as well.
You might be aware that HB 29 is going to be presented right now by Irna Minjares from San Antonio.
She's from El Paso, actually.
Well, she's moving a bill in this legislature so we can give physical therapists direct access. So I will.
Let me say this.
Quick, I want to take questions.
Okay, go ahead.
Quick. Okay.
No, I was going to say, I'll name names. Texas Medical Society, the El Paso Medical Society.
I was unhappy that you were going to keep going, but since you're naming names, please go on.
From opening up the scope of practice, Evan.
I like that.
Yes, my
Talk
name is,
smack, Senator, please, all day long. Go ahead.
I'm Dr. Lisa Hennessy. I'm the director of our Nursing Management and Administration Master's Program. So I don't have a question as much as a challenge for our legislators to stop thinking and speaking of advanced practice nurses and other professionals as physician extenders or mid-level providers.
Okay.
They don't provide mid-level care. They provide highly specialized care for which they are educated and trained and have experience.
Okay, this is obviously a big issue.
So that's the first step in changing our perception is stop thinking about us as mid-level or physician extenders.
Noted. Excellent. Ma'am.
Thank you for coming today. My question has to do with where do we go from here? Thank you for your perspective on all these things. But I'm thinking in terms of grassroots advocacy. As professionals, we are thinking, certainly at this university, in terms of interprofessional interaction. And there are issues that are going to be individual, like direct access for PT or sunset review that's coming up for marriage and family therapists and psychologists and counselors. Student loan repayments bills that have already been mentioned. But there is the opportunity for us to interact with each other as across disciplines. So in terms of your committee assignments and what we can do, how could we be the most effective in terms of speaking?
It's a really good question. This is the old civics issue of how do citizens affect the outcome of the government that represents them? You all have had some experience with this. Mr. Blanco.
Sure. My cousin, Christy Blanco, she's a women's health nurse practitioner, and she serves on the state association that advocates for she's here? Hey, Prima, how are you? These are the state associations that are very active at the Capitol. They are the ones that are providing testimony on bills. They're the ones that are coming to our offices and educating legislators. I come from a family, both my parents are nurses, and the first thing they told me is, the advice that they gave me when I started serving in the House is, make sure you get politicians out of the way from patients and their healthcare professionals. You all have to come up to the Capitol. You have to invite us here locally, and I've met with a lot of people locally to educate us about the issues. I think that's the most important thing.
Representative Gonzalez, you know, there's a cynicism, understandable. You have these hearings where the cake is already baked before people show up to testify. You have an issue and there are 500 people that show up to testify against legislation, but because the politics of the Capitol is what it is, those 500 people are listened to in big air quotes, and then they go and they vote the same way they would have voted had those 500 not showed up. So how do you avoid cynicism as a citizen if you want to petition your government to do something differently?
I hate when that happens. I hate when we have bills, and you're right, 500 people show up and say how important or how disastrous the bill is, and the bill has already been decided. The interim is one of the most important parts of public policy making. We meet every 2 years for 140 days to go over 10,000 bills. You can imagine the chaos that is in that 140 days. So here's my ask to directly answer your question. What is the responsibility for grassroots leadership? One is just be organized. I think that a lot of times we exist in our little silos, our little group of friends, the one person here, the one person there. But when you get a mass, numbers move people and politics, right? So you get 30 people, and then you meet with us, and from that 30 it grows, right? And I think that teachers are a really good role model. They were organized, they were on social media, they got their people out to vote, they got their families out to vote, they had t-shirts. Educators vote, they had rallies, they had their issues, and they were very, very strategic in how they did it. They flipped seats. They said, if you're not gonna be for educators and public education, we want you out, and that message was heard, and that's why they're at the top of the list. I encourage medical care folks to become equally as organized and really push the boundaries.
Senator, let me just, with time running out, if you don't mind, let me just go right here. Ma'am.
Hi, Leah Wiggum, the director of the Paso del Norte Institute for Healthy Living at UTEP. We are leading the way here in El Paso in a couple of very important areas related to health. We now, thanks to our partnership with Commissioner Stout and the leadership from the rest of the county court, we are the first county in the country to pass a healthy food finance initiative, which, as Representative Gonzalez mentioned, is going to lead the way to increasing access to healthy food. We are also the leading region in the country for healthcare providers who have been trained in obesity management. And that's thanks to an educational program that our institute has launched with support from the Paso del Norte Health Foundation. We can't help in these areas if we don't have leadership at the state level. So my question to you is, how can we work together to take the progress we've made here in our region and extend it to the state level so we have access to healthy food, right, so that our providers can bill for important services like nutrition counseling and weight management care, that weight loss medications can be covered by healthcare insurance.
Rep. Ortega, let me ask you to jump in if you have a point of view about this. What can we do?
Well, adding on to what Representative Gonzalez says, I mean, organization is really important, and obviously you've been effective in what has happened at the county level. And I think that, yes, it's important to provide testimony at hearings, but it's also important to go to the Capitol, to go over there and knock on doors and to talk to the chairmen of the various committees and the members of those committees on whose bills they're going to be reviewing, listening, and deciding how to vote. So it's really, or pick up the telephone and make those calls, because your voice needs to be heard to make a difference.
I'm going to brag a little bit on the El Paso delegation. We love meetings. We had one this morning, and especially if there's food. So feel free to invite us to food. I love tacos, but I sat in a workshop about obesity, and it really changed the ways in which I view the whole issue and how I view public policy. And so here's my point. Invite us to a meeting and teach us. I know a lot about school finance. I know a lot about how to raise goats. I do not know a lot about Medicare, Medicaid issues sometimes, and I need to learn. And so here's what I say. We want to learn. Invite us to a meeting. Invite us. When I sat in that workshop, it was literally life-changing. I went home and talked to my dad about it, and it's changing my family and the way we look at obesity. So I want to say thank you for your hard work for our region, but here's how we can do it. When we learn more, when we humanize issues, we create good policy.
Good. Ma'am.
Hi, my name's Laura Marquez. I'm a Master's of Social Work student here at UTEP, and I'm also a member of NAMI on campus. So speaking of mental health, and thank you, Rep. Moody, for what you said regarding stigma and related to mental illness. It's very important that you said that. I have just a few numbers that I want to share with you. So the recommended amount of student to a professional ratio that's recommended is 1 to about no more than 1,500. So right now, as it stands, our counseling and psychological services is sitting at one practitioner for every 3,134 students. You all know we are in a mental health crisis on college campuses. Suicide is the second leading cause of death among college students, and 1 in 3 college freshmen struggle with mental illness. Yep. So I realized that there was legislature trying to be passed, or trying to mandate something as far as college campuses goes. Is there something else in the works, something else that can be done to
Representative
help
Moody,
this?
what about that? The numbers are pretty jarring, aren't they?
No, it's one of the most troubling things that we need to still focus on, especially the suicide rate and suicide attempts. In college campuses, those numbers are going up. Youth suicide rates are going up, specifically among our LGBTQ population. It's probably the most difficult subject that we've had to tackle. And how do you address it? Especially, I mean, let's think about it just for right now. We're in the holiday season. So let me just say this to everybody. You can be the voice that makes a difference for someone in their life. If you feel there's something going on, there probably is. Make that call. Reach out. You may not have the answers, but you can save someone's life just by making that call. So just think about that during the holidays. You see an uptick in suicide attempts in the holidays. So what we need to do is continue to focus that, not just in the college campuses, but in our public education system. It was the one place where we really didn't make a lot of headway last session, and we need to continue, because if we're more proactive when we get into those situations earlier, we talk about emotional health. We have a multi-tiered system of care that we approach from that level. Then we can do better, and we can address those issues before they step foot on a college campus. But it's absolutely critical. And so thank you for raising the issue.
Thank you. I'm going to have to call this one the last question. We're hitting up to 1 o'clock. I'm really sorry. Maybe people could stay afterwards and talk to our legislators or one another, and I do terribly apologize for having run out of time. Sir.
Thank you. My name is Carlos Zuniga. I'm not a nurse practitioner. My wife is. She's actually president-elect of the El Paso Nurse Practitioners Association next year. But I just have something for each of you. You all can make this pass this time around. Why don't you do it? You know what the problems is? Nurse practitioners have been going up there for years and been roadblocked. You know what the problem is. What are you all going to do about it this session?
I feel like we've actually addressed that. No disrespect. I feel like they've said they're back at it, and we'll be back at it. So if you don't mind, I'm going to take one more question over here, just out of deference to our many friends in the room. Go ahead.
Hi, my name is Clarissa Medrano. I'm a graduate student in the occupational therapy program here at UTEP. I am a former public education teacher and now soon to graduate in the healthcare field. So public education, healthcare, and mental health are near and dear to my heart.
Yep.
So with the lack of expanse in Medicaid and other healthcare programs, and the lack of recognition of occupational therapy as a behavioral health provider, a lot of clinics are closing. There aren't enough organizations that employ occupational therapists in the mental health realm. Will we, as graduates, need to leave Texas in order to find gainful employment?
That's exactly what is happening.
Yeah, we hope not.
So we hope not. I mean, I think this whole discussion is all about the finances of healthcare and programs and what needs to be done to keep people in our medically underserved areas. But that's a whole,
what can we do as...
So what the legislature has done regarding occupational therapy specifically is a travesty, right? Like, we know that kids need access to therapy, and it's a behavior, it changes their lives, right? I've seen kids who we thought wouldn't be successful in a classroom go through therapy, and now they're reading and they're writing and they're productive. That long-term impact is we can't even describe it. Mm-hmm. The legislature has done some really bad policy in this area, and you know what's sad? It's really about politics, not good policy. It was a political move that changed this occupational therapy rates and has really caused the closure of a lot of clinics. Here's what I do think is good. You do have a lot of people who have been advocating. there is a change in leadership, which creates a new opportunity to really push through some of these things, and the people who are previously roadblocks no longer exist in the same ways. And so here's what I ask, and I know you've been fighting this for a long time, is to keep on fighting. And you're fighting for kids because I've seen how y'all and your therapy work friends and colleagues have changed people's lives. And so what can you do is just really you're doing it. Keep on fighting, keep on creating awareness, and get the media involved.
Good. I think that's a good place to end. What it says to all of you, this question, but every question, is just keep paying attention. The election's over. Texas is not over. Legislature's coming in. Pay attention. Stay engaged. Use that same energy to advocate for the things you care about. Give our state lawmakers a big hand. Dr. Natalicio, UTEP, thank you very much. Happy holidays to everybody. We'll see you back again in 2019.